So, today we're going to be talking about autism, understanding what it is and what it looks like. A lot of the individuals that we work with have the diagnoses of autism, and sometimes we might see them engage in some challenging behaviors. And it is important to understand that these challenging behaviors may be their way of communicating their needs, wants, if something is wrong, if they're not feeling well, if they're scared. So today we're going to talk about autism and understanding what it is. So before talking about autism, it's important to understand what mental illness is. This is a condition that affects a person's thinking, feeling, or mood. It's a condition that affects a person's ability to relate to others and function each day. For example, a person with a mental illness may have some difficulty in performing their duties at work, or they might have some difficulties in maintaining and keeping a relationship with others. It's also important to understand that even though many people may have the same diagnoses, the experiences is going to be different. And so before understanding what mental illness is, it's important to understand what mental health is. And this is where an individual is able to function effectively in his or her daily activity. So they're able to keep a job, they're able to maintain friendships, they're able to carry out any daily functions that they need to. Mental health is the foundation for thinking, communication, learning, resilience, and self-esteem. It's also key to relationship, personal, and emotional well-being. Some examples of mental health is where an individual is able to maintain a healthy relationship. They have the ability to adapt to change. They're able to cope with challenges and difficulties, and they're able to engage in productive activities. Now, mental illness, on the other hand, is where an individual has difficulty in carrying out everyday function and activities. The individual may have significant changes in his or her thinking, emotions, and or behavior. So, as I mentioned before, a person that has mental illness, sometimes, they have difficulties in engaging in everyday functions. It's not that you're not able to do it, but it's just hard for them to complete everyday functioning and activities. It's also important to look at intellectual disability and understanding what it means, as well as understanding mental illness. Intellectual disability is where an individual lacks the skills necessary for day-to-day living. However, people with intellectual disabilities can and do learn new skills, but they learn and process them more slowly. An individual with intellectual disability may vary from mild to profound. A person with intellectual disability has two limitations, and one is intellectual functioning and the other is adaptive behaviors. Intellectual functioning refers to a person's ability to learn, reason, make decisions, and solve problems. Adaptive behaviors are the skills necessary for day-to-day life, being able to communicate effectively, interact with others, and being able to take care of oneself. Communication plays a major role in the lives of everyone, even individuals with intellectual disability. Sometimes, however, communication can be difficult for them. For example, they might have stronger receptive communication skills, meaning they're able to understand very well, or they may have the ability to express themselves, but may have difficulty in understanding and perception. So, for example, individual with intellectual disability, they may do really well in understanding what is being communicated to them. However, they may struggle in expressing themselves or communicating their needs and wants. They may also be delayed in responding to questions, so much so that answers may seem to come out of nowhere. So, for example, you might notice that when you're talking to your individual or complete a task, they may not understand when you say it the first time, and then you notice that you may have to rephrase it or use shorter, simple sentences. This is just an example of how communication may be difficult for some individuals with intellectual disability. Now we're going to talk about autism spectrum disorder, or also known as autism. This is a developmental disorder that affects a person's ability to socialize and communicate with others. A person with autism may also have restrictive, repetitive patterns of behavior, interests, or activities. The term spectrum in the diagnosis refers to the wide range of symptoms and skills and levels of impairment that a person with autism can display. Some people with autism are mildly impaired by their symptoms, while others are severely impaired. Individuals with autism may display many symptoms. However, it is important to understand that with each person with autism, every symptom may. So one person may display a different symptom as opposed to another person with autism. So, for example, one individual that has autism may like to hum, as opposed to another individual with autism may like the sound of running water. So, here are some symptoms of autism: getting upset by minor changes, humming, having unusual and sometimes intense reaction to the way things smell, taste, feel, sound, or look, abnormal body posture or facial expression, avoidance or poor eye contact, inappropriate or no social interaction, self-harm, repetitive behaviors and movements, for example, flapping of hands or rocking back and forth, difficulty communicating, excessive interest or limited interest, compulsive behaviors or behavioral disturbances. Now, as we have learned, individuals with autism may have difficulty in communicating what is bothering them. It may also become even more challenging because they're not able to communicate well what is bothering them or what they need. Now, here are some common triggers that may lead to challenging behaviors: crowds, loud noises, being in an unfamiliar setting or environment for long periods, elevators, changes in routine, changes in the environment, for example, new staff, old staff left, or even the weather. Underlying medical sensory issues, for example, feel, taste, smell, or sight may cause discomfort, anxiety, or even specific phobias. So it's important to understand that many things can trigger an individual with autism, and we must be aware of this. Autism and behavior. It's important to understand that all behaviors that a person display, whether it is positive or negative, serves a function. There's always a reason behind any behavior. All behaviors are influenced by events in the environment or influenced by internal triggers. Individuals with autism display many common challenging behaviors. Here's a list of some: disruption, incontinence, which means that the person may have difficulty in controlling themselves, not following instruction or redirection, obsession, compulsion, or rituals. Physical aggression, tantrums or meltdowns, pica, which is eating objects that are not edible, rectal decontamination, which is spitting up digested food, voluntary or involuntary, and sexual inappropriateness. An example of that can be masturbating in front of others or in inappropriate areas. For individuals with autism that are known to have a routine, for example, they wake up at a specific time, you know this is when they have their breakfast, you know they want their lunch, you know this is they take naps at a certain time. If they have a routine and then you notice an increase in behavioral challenges, it's important to look at many factors. So, a possible cause for an increase in behavior challenges can be medical, a sensory problem, environmental factors, or family staff dynamics. For medical, you might want to ask yourself, is this person, are they having enough sleep? Do they have stomach issues, dental concerns, vision or hearing problems, or is it allergies? If it's a sensory problem, you may want to consider that they may have unmet or overwhelming sensory factors. For example, is it too hot or cold? Is a person hungry? Is the clothes that a person wearing itching them? Does the shoes or slippers feel? Is the clothes too tight? Is it too loud, or is the area that the individual in too crowded? Environmental factors. You can look at location, day, setting, or activity. For example, is the individual too tired? Do they want to go to another area? Do they need to be engaged in activity, or do you need to change an activity? Family staff dynamics, changes in family or staffing. Does he wish to see a family member? Is this person missing a family member? Has there been a shift in staffing? Did the favorite staff leave? So these are all things to consider when there's a behavioral challenge increase. Here are some other possible challenging behaviors that an individual with autism might display, and here are some reasons for it. If the individual has their fist jammed in their mouth or down their throat, they might be experiencing acid reflux, toothache, or nausea. If the individual is refusing to sit, they might be experiencing back pain, rectal problem, or they might be feeling anxious. If the individual is biting the side of their hand, they might have a toothache or they might have a painful sensation in their hand. If the individual is sitting unevenly, like they're sitting on their side, they may be experiencing hip pain, genital discomfort, or rectal discomfort. If they're scratching their stomach, they might be experiencing gastritis, ulcer, or have gallbladder problems. If they're scratching, hugging it may be acid reflux, pneumonia, or angina. If they're stretched forward or leaning over their table, it may be back pain, hip pain, or acid reflux. If they are waving their head side to side, it might be a decline in peripheral vision, meaning that they're having difficulty out from the side of their eyes. If there is an intense rocking back and forth, or they have a preoccupied look, it may be depression, or they might be having a headache. If they are engaging in head banging, there might be pain, depression, migraine, dental, a seizure, earache, or sinus. As a reminder, autism is where an individual may have impaired communication, impaired social interaction, and they may engage in repetitive restrictive patterns. An individual with autism may experience feelings of frustration, confusion, anxiety, or lack of control. If this occurs, you might notice an increase in challenging behaviors. For a person that does not use words to communicate, he or she will voice their wants, needs, or concerns through behaviors. Now, challenging behaviors are more likely to appear when a person is feeling unhappy or they're not feeling well. Very often, there may be underlying medical concerns or sensory responses that we cannot see, and this may be the reason for challenging behaviors. This person might be in pain or discomfort, or they might be feeling sad. And they're not able to verbally say so, so sometimes they might express this through a challenging behavior. So, for example, behaviors that we might observe can be pushing, charging, kicking, throwing, pulling, grabbing, or biting. But really and truly, the core problem beneath these challenging behaviors can be poor social judgment. The person might have an unawareness of how they're feeling. They may be experiencing sensory misconception. They might be frustrated over not being able to communicate well. They might be feeling frustrated because they do not know how to interact appropriately, or they might be afraid or feel uncomfortable about something. So it's important to understand that yes, we might observe these challenging behaviors, but once you see this, take a minute and ask yourself what might be the core reason behind these challenging behaviors. Some individuals that have autism might engage in excessive overeating. Now, the excessive eating might be an underlying medical concern. But first, it's important to ask yourself these questions. Is it a habit? Is the person snacking at a particular time of day when he doesn't have anything in particular to do? Is it a compulsive, obsessive compulsive behavior? Is it more than just a habit? Does this person have an obsession with a particular food? Can it be side effect to medication? Some medications can increase or decrease appetite. Is it because the person has unpredictable meal times? If there's no set meal time, then the person is more likely to want to snack throughout the day. Is it sensory sensitivities? For example, if the person likes the feel of soft textures, he might seek out regularly soft foods. Now, if the individual is engaging in excessive eating and all medical concerns were ruled out, there are other ways we can manage the excessive eating. We can establish regular meal times, ensure that the individual is drinking plenty of water throughout the day. Sometimes a person might feel hungry, but really in fact they're just thirsty. Have many activities handy to keep the person busy until it's time to eat. Engage in physical activity. Replace one sensory object with another. For example, if the person has a sensory feeling for food, you can replace it with something that's not food, but it's similar to the texture of that food. For example, if the person likes the feeling of soft substances in their mouth, for example, bread, then try giving him or her Play Doh to their hands instead. When working with individuals with intellectual disability or autism, it's important that we all work together as a team. Remember to be person-centered. Remember that you are not in this alone. So it's important that you can collaborate with each other and come up with ways to better support the individual. Be committed to being on the same page. It's important that we all try to be on the same page. That way we can establish some structure in the individual's life. If each staff is on a different page, then more challenging behaviors may occur. Remember that the individuals that we work with, they are humans too. They are humans first. Their diagnoses do not define who they are. So it's important that we work as a team each day and we be there for each other. Now, let's say an individual is engaging in a new challenge behavior and we're trying to figure out what might be the underlying reason for this. We can work as a team in solving this and try to come up with a solution. First, it's important to identify the problem. Remember the core deficits, as mentioned earlier. It's also important to look at the environment. Is the individual being overstimulated? Is the individual hungry, thirsty, or needs a bathroom break? Are they feeling unwell? Was the person's routine or schedule interrupted? Or did someone respond negatively towards the individual? There are many ways to calm an escalating situation for the individuals that we work with. It's important to be on alert for triggers and look out for early warning signs. Try to remove anything that might be causing them stress. For example, remove distractions or move the individual to a less stressful place. Provide a calming activity or give them an object that will help to calm them down. It's important that when any situation is escalating, that we try to remain calm, remember to be gentle, and remember to be patient. Give the individual space, but still monitor them to ensure that they are okay. Provide clear directions. Use simple, short sentences. The more complex your sentence is, the more likely the individual might increase in irritability or they might get upset. If the individual does make an effort in trying to calm themselves down on their own, it's important to provide them with verbal praise as they are making an attempt to regulate their emotions on their own. Work together as a team and be proactive. It's important that when we are on shift that we try to be as proactive as much as we can. When an individual is in crisis, it's important to understand that this is not a teaching moment. This is not where you will be able to teach the individual how they can manage any stressful behaviors. Now is the time where you have to be reactive. So, you must remain as calm as possible. Ask another staff to assist. Be mindful of tone of voice. Do not shout. Assess the severity of the sin. As mentioned before, it's not a teaching moment. You're not able to teach the individual anything. At this point, your main goal is to keep the individual safe, and try to redirect them. Follow reactive strategy, their behavior support plan. If the individual's behavior escalates to the point where they are a danger to themselves and others, you will call 911, notify management, and the assistant director. The individuals that we work with, it's important that we try to offer as much positive behavior supports. And this can be done in many ways. Establish a daily routine, develop structure, and ensure to be consistent with it. Proximity. This is a very great silent intervention, and it can be done by simply getting closer to the individual physically. You can redirect them without even having to give verbal instructions. Alternate tasks. If the individual seems to be getting frustrated with a particular, you can change it and do something fun instead, and then come back to the task. Provide breaks. Exercise. This exercise doesn't have to be boring, but make it fun. Jogging in place, stretching, dancing. Try to make the exercise fun. Provide positive phrasing. For example, instead of saying, do not eat all that bread or all that food, you can say, let's save some for later, or let's save some for tomorrow. Redirect without having to say no. It's always important that you provide verbal praise, edible treats, or a desired activity. It's also important that you validate the person's emotions. Do not brush it aside, as it's important that you do validate their feelings. This will help to overall build their mood and self-esteem. There are many environmental factors that can increase the challenging behavior with individuals with autism. Therefore, simply we try to adapt to the environment around them. Organize and provide structure. This can be visual schedules, calendars, or just having a consistent routine. Inform the individual of a transition or a change. If this is not done, it can be extremely unsettling when it is unexpected. The individual might become afraid or they might become frustrated. Supports. This can be a chart, it can be a calendar. Provide a safe place and use that time to teach new skills or engage in an activity. Remove distracting or disturbing stimuli, for example, noise, flickering lights, or high traffic times. High traffic times can be a lot going on during, meaning there's lot a lot of traffic in the common area, and this might be coming for the individual. What you can do is move them to their bedroom and engage in an activity of their choice. For individuals with autism, there are many visual supports and interventions that can be used to help in minimizing challenging behaviors and also increase their communication skills. The picture exchange system, also known as PECS, this is an approach that uses pictures instead of words to help people communicate. Pictures of common symbols, objects, and photographs are used to convey very simple messages. Electronic augmentative communication devices or devices that permit the storage and retrieval of messages, allowing the user to communicate with others. Schedules and routines. Developing schedules will bring structure and help minimize the frequency of behaviors. Here are some examples of communication tools. This here is an example of the PECs, the picture tools to help individuals with autism communicate. Here you can see a picture schedule has been implemented for an individual with autism. As you can see, they use many pictures to help the individual understand and help them communicate their needs and wants. Pictures, a lot of individuals with autism, they do very well visually. Many challenging behaviors can arise for the individuals that we work with, and significant impact on others. There can be added stress and worry, anxiety or depression for staff and individuals. An individual that's very challenging will need more time and attention in order to be directed. Therefore, less time and attention will be provided to other individuals, and staff will have less time to complete their responsibilities. There might be a fear of individuals harming themselves or others. There might be faster staff burnout and increased turnover. Challenging behavior can also overwhelm other individuals in the residence, and this can overwhelm their ability to cope and intervene. You might also see an increase in challenging behaviors in other individuals. Challenging behaviors can also overwhelm staff' ability to cope and intervene. You might even notice that staff may call out or become easily frustrated with other individuals. Working with individuals in this population can be overwhelming and frustrating. However, it can also be very rewarding. Sometimes it might get to the point where staff may have difficulty coping due to the challenging behaviors they are faced with daily. Here are some strategies for staff to implement when they are on shift. If work becomes too overwhelming or emotionally draining, you should take time off. You can also talk to management about how you are feeling. You can also talk to your behaviors as well. Try not to take work home with you. Planned ignoring. It's important to understand what planned ignoring is and not confuse it with just ignoring the individual entirely. You are to ignore the behavior but not the person. Of course, this depends on the situation. If one particular individual is targeting you, you can switch out with another staff for a while. Avoid any power struggle. Engaging in power struggle with any individual will just increase an escalation in behaviors. Remember to work as a team and help each other. You are not in this alone. In any relationship, communication is always key. Work relationship, communication is key. Personal relationship, communication is key. Working with the individuals that we support, communication is key. Effective communication can make a big difference. And there are many ways in which communication can be carried over effectively. One way of trying to communicate effectively is trying to establish rapport. This is done by speaking directly to the individual. Avoid talking to the individual as if they are a child. Remember, they are an adult and they have feelings too. Use positive comments and positive reinforcement. Try to develop trust with the individual. Show empathy and understanding, and also acknowledgement of their feelings. Another way to communicate effectively is using appropriate language. It's important to avoid shouting. Use concrete language. As mentioned before, it's best speaking in simple, short sentences, as this allows the individual to better understand what is being asked or requested of him. Use examples from daily and familiar routines also to ensure understanding. Listening is another part of communicating. We must listen to what the individual is saying. Do not disregard or put down what they are saying. What may not be important to us may be very important to them, and we must respect that. Allow enough time. Be sensitive to tone of voice and body language. Be mindful that you are not shouting, and be mindful of your body language. Explaining clearly is another way of communicating. You want to make sure that you explain in detail to the individual and ensure that they understand what is being said to them. Speak slowly and remember to not shout. Rephrase questions and ensure that the individual truly understands what is being said to them or asked of them.